I'm Pamela Wilson, the Care Navigator. My company supports family caregivers and those seeking care or support when health, memory, physical, or organizational ability changes. We provide support in 5 beneficial categories. 1. Unexpected situations. 2. Ongoing oversight of daily care needs, including household management. 3. Assessments and recommendations. 4. Legal advocacy, serving as guardian, power of attorney, and personal representative. And 5. Care transitions when living at home may no longer be possible or additional support may be needed. Click on the How We Help page of our website for specific information about these categories of service. I'm Pamela Wilson, the Care Navigator, providing solutions for life's unexpected changes. Do you suspect your loved one has memory loss, but you're not really sure? One of the first signs of memory loss is loss of organizational function. This includes the ability to appropriately manage a house and property. Are you noticing handwritten notes all over the house serving as reminders? Is your loved one missing doctor or other appointments? Are you noticing that conversations are forgotten almost immediately? Are questions repeated within minutes of a response? Or stories repeated over and over and over again? When you visit, are piles of mail, magazines, and newspapers stacked on the kitchen table? Have you looked at prescription bottles to see if they've been filled recently? Do you notice your loved one wearing the same clothing day after day? Is their hygiene not as good as it once was? Hair not washed, body odor? Are you noticing needed home repairs that never seem to be completed? Any one or all of these are signs of memory loss. If you bring up the subject of memory loss, your loved one may deny that they're experiencing any changes. They might become angry that you're bringing up the subject at all. How many times do we hear, "I can take care of myself," when we know this is probably no longer possible? What's beneficial medically? In my years of experience, many older adults feel obligated to continue seeing their family physician. Most, if not all, family physicians have little experience diagnosing memory loss, and many don't specialize in the health issues of older adults. It's exactly for this reason many older adults experiencing memory loss live for years without a diagnosis or treatment. Most physicians fail to explain the long-term effects of memory loss. Many don't want to give patients what they view as bad news. For persons with memory loss, the changes experienced in the ability to manage daily life is significant. Dementia, frontotemporal dementia, Alzheimer's disease, Lewy body disease, and moderate cognitive impairment are some of the words used to describe the symptoms of and the diagnosis of memory loss. It is important to seek a diagnosis as soon as possible from a physician specializing in the diagnosis of memory loss. These specialties include the areas of geriatric medicine, neurology, and neuropsychology. Early diagnosis allows more time for planning. While there is no cure, medication exists to slow the rate of memory loss and to support management of behaviors like anxiety and paranoia. If you are an individual suspecting memory loss, if you live alone, without family, or without family nearby, many times there are few people in regular contact with you enough to notice the symptoms and to suggest a medical evaluation. If a friend tells you that you seem to be more and more forgetful, please listen. For individuals living alone, by the time memory loss is diagnosed, the degree of memory loss may be advanced. Behaviors may include episodes, uncharacteristic behaviors, attributable to a diagnosis of memory loss. Very important is to make a long-term plan for care so that when you or a loved one are no longer able to make decisions, there is a trusted, designated person, a family member or a professional advocate with the legal authority to manage the details of beneficial care at your prior written direction. If you're in a situation where you suspect memory loss for yourself or a loved one and you aren't sure how to move forward, contact me and I'll help. It's easy. There's a contact sheet on this website where you can enter information or simply pick up the phone. I'm Pamela Wilson, the Care Navigator. My company supports family caregivers and those seeking care or support by identifying needs, providing recommendations, and coordinating care. The Care Navigator, solutions provided for life's unexpected changes.